Hi, this is Dr. Kersi Chavda. I'm a psychiatrist associated with the Hinduja Hospital at Mahim and Khar. I'm going to speak a little bit about depression, and then I'm going to speak a little bit about the destigmatization of mental illness, which is so very important in today's time. Depression is the commonest psychiatric illness. Whether we like it or not, it's supposed to affect 1 in 3 to 1 in 4 people. Whether we like it or not, we are finding depression occurring in younger and younger age groups. Whether we like it or not, it's all around us. So what really does depression do? It makes us feel inadequate. It gives us a feeling of worthlessness and helplessness. We have problems sometimes in sleeping, in eating, in our normal biological functions. There's a feeling of inadequacy. There's a feeling of dissatisfaction. There's a feeling that we don't like doing what we would normally have loved doing, for example, watching movies or going to the gym. We find it difficult to concentrate. Sleep issues are commonplace. Appetite issues are commonplace. We have problems with evacuation of our bowels. The most frightening aspect of depression actually is there's a huge number of suicide cases which occur because a person has been depressed and inadequately treated. A lot of people talk about this chemical locha thing which happens. And of course, there is chemical locha, but there's a huge number of other things which are also known to cause depression. We know that there are circuits in the brain which get affected. We know that there are certain specific areas in the brain, the frontal, prefrontal cortex, which get affected during depression. If you actually do PET scans and SPECT scans, you're going to find differences in what you see in the brain in these areas of people who have depression versus those who don't. Given all of that, it is imperative that we should know that depression is here. Depression is commonplace. Depression does not depend on the economic status. I mean, so often I have people coming in and saying, but he's earning so much money, he's got such a lovely job, he's got 2 lovely children, he has a fantastic family, why on earth should he be depressed? So you can be depressed. The bottom line is depression is an illness which needs to be looked at. When I was a medical student many years ago, we were told that depression starts around age 17 or 18. Today, my colleagues and I are actually diagnosing it around 10, 11, some even younger. We're thinking in terms of depression at very young ages. For example, if a little kid starts jumping milestones, then people keep that in mind. There's no diagnostic label given at that time, but it's kept in mind. We look at it in terms of men and women. It seems to be commoner in ladies, possibly because there's also a huge hormonal relation. So before menstruation, after menopause, pregnancy, there seems to be an increased incidence of depression. Psychosocial factors, of course, they do play a role. But the bottom line is different people react differently to the same psychosocial stressor. So obviously, there's a huge amount of attention that is now being paid to genetics. And we found specific genes which seem to get affected, which cause depression to occur. Hence, you'll find that 3 people reacting to the same stimulus, reacting to the same stressor, will react in a different way. And that's because of their genetic makeup. Today, psychiatry is an exact science. So we no longer just talk of esoteric philosophies of cold father and inadequate mother or things like that. Those are important issues. We are talking more in terms of transmitters. We are talking more in terms of circuits. We are talking more in structural changes of the brain. These are what cause a particular disease to occur. And hence, it is imperative at times that we treat it the way the doctor suggests it should be treated. Now, what are the treatment modalities? For mild one, first of all, it's very important that you get a proper evaluation done. So it's essential to actually go to a psychiatrist preferably, or a psychotherapist or counselor. To go to a friend or an uncle or an aunt or somebody else who has a smattering of knowledge is extremely dangerous. It's probably even more dangerous to get diagnosed by Dr. Google. Let us remember, Dr. Google is not a doctor. He's about 18 or 20 years old. Whatever I type into Dr. Google will come out. It's not necessarily based on fact. So certainly you might be able to use it as some kind of input, but for God's sake, don't base your diagnosis on Dr. Google. I mean, if you had a fracture, you wouldn't put a hand in front of the screen and say, Dr. Google, put a plaster on me. So just like that, do not look at Dr. Google as a doctor. There's nothing more irritating than people coming up to us and saying that I know I have this, and I know this is my treatment, and I know this is going to be my side effect. Great. It's wonderful how your 1 hour of Dr. Googling has compensated for so many years that I have been a doctor. It doesn't work out like that. So let us be sensible and seek professional help. What are the modalities of treatment? There is therapy, there is medication, and there are others. So if you're looking at therapy, there's something called cognitive behavior therapy, which has been very widely used. There's something called rational emotive therapy. There are a whole bunch of other eclectic therapies, etc. Basically, over here, the therapist attempts to maybe change your reactions to a particular way, to a particular problem, and look at alternative ways which would enable you to get out of the depression that you find yourself into. There's a huge amount of work which has happened with CBT and REBT, and those seem to be fairly effective with mild depression. But if you're going into moderate and severe depression, medication is probably very, very important. And there are a huge number of medications that are available. There are medicines from various families which are available. Now, at one time, many, many years ago, the tablets, the medication were not as specific as we find them today. So even though they might have alleviated your depression, we'd also find that they have side effects. There would be severe constipation, there might be too much of sleep, there might be a huge appetite, there might be blood pressure issues, and so on. Today, with the increasing number of antidepressant molecules which are coming out, we do see that these kind of side effects can be minimized to a large extent so that the person reacts the way he's supposed to react without getting the side effects that were seen in the past. Let us also be very aware of the fact that you cannot necessarily use a tablet just because your uncle or your auntie used it. So often we have patients coming up to us and saying, oh, my auntie had this and she used this medication, so I've used the same thing. And that is extremely inappropriate. There is a proper detailed evaluation that is being done. Everybody will have their own signs and symptoms. There will be modalities that we look at in terms of age, in terms of comorbid issues, before we put you onto a medication. So let the doctor decide. You don't decide for the doctor. Let's also look at the fact that if we are looking at medication, we are looking at it in terms of the kind of timing that is necessary. The doctor might suggest something at a particular time. It might be after meals. It usually is after meals, excepting for a few. We also need to remember that it's very rare that a person has only pushed himself with his psychiatric problems into one particular category of issue. So normally, if a person is depressed, there will also be elements of anxiety. If a person is anxious, there will be elements of depression. And we keep shifting diagnosis. We keep shifting from one kind of spectrum to another. This is very commonplace. So don't get too hassled, don't get too upset if your doctor says that there has been a change and I want to add something or subtract something. This is normally found when we are dealing with psychiatric issues. Medication, psychological treatment, the psychotherapies, and the others. ECTs, electroconvulsive therapy, was used profusely in the past. It is still an extremely important method of treatment, but there are people now who believe that there should be more safeguards before using it for all and sundry. It is still very often the treatment of choice if a person is extremely suicidal. Very often the treatment of choice, even in pregnancies where you can't maybe give some medication because of the comorbid conditions. So it is an extremely important method to treat depression. We have the newer therapies, something called RTMS, TDCS, all of those are also available in specialized centers. Psychosurgery, people are trying deep brain stimulation with batteries which are placed in certain areas in the brain, and they seem to help in certain situations. Now we must remember, at one time we felt that depression was only seen after the age of adolescence. Today we are seeing it at younger age groups. The kids might have issues relating to their own behavior, and they're badly behaved. And when you start questioning them, you find that it's not really a case of aggression, but it is that they feel so very depressed that they start reacting in a particular way which comes across as being aggressive. Hence, the rule of thumb is that when you're dealing with an aggressive kid, actually soften your stance. You do not have to be more aggressive in return in order to prove a point. That would probably be doing a disservice to the child and the child's condition. The other treatment modalities, like I said, are available in very specialized places. They're becoming more and more commonplace. A lot of them have very good result patterns which have been researched upon. So if you have a possibility of getting into a certain center which has all of these extra treatment patterns, that is also worth your while. What are the frightening aspects of depression? Like I said, probably the most frightening aspect is suicidal stuff. So we talk about suicidal ideas, which I guess all of us have. Occasionally we all say, oh my God, why am I alive? Life is a pain, etc., etc. But it's just a fleeting thought. Then it becomes an idea. Might be a good idea for me to die. Then you start thinking about it more and more. Then you start doing things to gain what you want to do. So you might start reading up things about how to kill yourself and things like that. You might actually go out and buy stuff in order to kill yourself. Those are the frightening aspects. And it is imperative at such a time that you seek help, or if you know that somebody else is behaving in a particular way, which is moving towards this, that they seek help. It is absolutely imperative that this should be done, because given the proper treatment, especially if it is early enough, we can get a person to actually start liking to live again. These things are not going to go away on its own. So stop being an ostrich and putting your head into the sand. It is absolutely essential that we land up getting into a place where we land up doing things related to reducing our depression and making us feel more like we should in terms of life. Given all of that, let's also look at the myths related to psychiatry and the necessity for stigmatization. Let us realize something. The given studies show that the incidence of mental illnesses is more than the incidence of cardiovascular illness, is more than the incidence of diabetes, is more than the incidence of respiratory illnesses. Given all of that, it would be stupid for us not to seek appropriate help at this time. Given all of that, it would be stupid for us to believe that it's just going to go away by our doing nothing, or just by doing yoga and meditation and going for a walk or eating good food. All of these are useful lifestyle changes, but they are not going to cause your depression to go away by and large. If you get into a situation where you're suicidal, it is absolutely imperative that you seek the help of a professional who will be in a position then to suggest medication, therapy, whatever else there is. So what are the myths? Myth number one, that all medicines are going to make you sleep. That is not true. If you don't sleep at night and you're depressed, I might give you something which, in addition to alleviating your depression, also enables you to sleep. So it has a side effect of sedation, which is very useful. If you're sleeping too much, I might actually give you an antidepressant, which, in addition to alleviating your symptoms of depression, actually make you more awake. If there are mood swings, I might give something. If you have diabetes, I might avoid something. If there is blood pressure and you have issues relating to your cardiogram, there are certain things which I will not give. If there are issues relating to your blood pressure, I will not give some things. But the bottom line is, it's the doctor who decides what to do. So let's not make this a bugbear Point number two, I'm a weak person if I seek help. That's nonsense. It's like saying I'm a weak person if I have diabetes. I'm a weak person if I have a thyroid dysfunction. I'm a weak person if I have cancer. Nobody looks at it like that. So if you're depressed or you're anxious or you have OCD or you get into an addiction, these are illnesses. And you've not done something or not done something to cause this to happen. It could happen to anybody. And like I said right in the beginning, if there is a propensity, if there's a genetic trait, then the incidence of this becomes so much more. So it is absolutely imperative that we do not believe that we are weak or stupid or we've done something wrong, hence we've got an illness, and what will people say? Now this what will people say is again something that's unnecessary. If you are ailing, if you have a problem, it's very unlikely that these people are going to come and help you. So if you need help, go and seek the help of a doctor. They will be able to treat you well, and you will not be in a position that you are currently. Hopefully, your mood will be alleviated, you will feel more positive, and life will seem a better place to live in. How long should medication go on? First episode medication for a whole bunch of illnesses should be about 9 months to a year minimum, under the supervision of the doctor. He might suggest certain things, he might suggest blood tests, X-rays if necessary, he might suggest mild alterations of medication. He might get you off some medicines which he wants, he might keep you on some medicines and adjust the dose if he needs to. Minimum of 9 months to a year is the norm in most illnesses. After that, when you start tapering off, there'll be about 50 or 60% who don't seem to have a problem, but there's a huge number of people who would. So you might need medication. And that again becomes a big thing. How can I continue with the medication? I have a question to ask. If you had high blood pressure and you were given an antihypertensive, and the antihypertensive worked and your pressure was normal, would you get off it? No, you wouldn't, because then the pressure would rise again. If you were diabetic and you were taking insulin or you were taking tablets to control your blood sugar, you'd continue it probably for the rest of your life because you were scared of the complications. You're not addicted to it, which is the other thing that happens. Am I addicted to your medication? Are you addicted to antihypertensives? Are you addicted to anti-diabetics? If you have a thyroid dysfunction, which is so very common today, you have to take a thyroid supplement for the rest of your life before breakfast. Are you then addicted to this thyroid thing? No, you need it. Your body needs it. So big deal. Then there's this question, but it works on my brain. Well, guess what? A lot of these medications work through release factors in the brain as well. But nobody bothers about that. In fact, you go up and you say, oh, doc, I can't stop this medication. Please, my blood pressure is not under control. Give me some more. Let's be sensible about it. I'm certainly not saying that every person who comes to us will need medication, but I'm certainly saying that if he's put on medication, follow the diktat of the doctor. Take it as long as the doctor says. Be sensible about taking it. Do not stop it when you want to stop it. There's nothing as irritating as a person who comes 2 months later and says, oh, I reduced the medication 2 months ago. I hope it's okay. I mean, what on earth does that mean? If you want to reduce something, you ask before you reduce it. And if the doctor says it's okay, it's okay. And if he says it's not, he probably should have the right to say so, isn't it? If you're going to see the doctor, then follow the doctor's advice. Otherwise, follow Dr. Google. What are the other myths? You're going to be a zombie all your life. You're going to lie in bed all your life. You're going to eat and eat and eat. Or you're going to lose weight. Or you're going to be under the doctor's control. All of this is absolute, unadulterated bunkum. When we're talking of side effects, of course there will be side effects. All drugs have side effects. That does not mean that you're going to be sleeping the whole day or eating the whole day, or you can't study, or you can't go to work. There are a huge number of industrial stalwarts who are on medication. There are a huge number of people from all walks of life who are on medication. There are doctors, lawyers, judges, etc., who are also taking help. It's a normal thing. It's a natural thing. It is something that we just need to get used to. And given the fact that post-COVID, we are estimating that there's going to be a huge number of people who, because of maybe economic issues, because of having lost a dear one in the COVID or having seen horrible visuals, have kind of toppled over. They were on a mildly precarious equilibrium. And because of this extra pressure that has been put on them, they've toppled over into a proper psychiatric illness. We need to deal with them. We need to give them medication. They may or may not be, it may or may not be necessary for them to join a group which is dealing with coping skills when somebody's lost a dear one in the COVID. There may be a necessity of dealing with their anger, which comes across, the frustration which comes across. A lot of people are drinking more, smoking more, taking more recourse to drugs. They may need help for that. You need to ask for help. Let's also take it that India has a huge child population. Kids may have attention deficit disorders, they may have intellectual issues, they may be part of the autism spectrum disorder. They're going to need medication for that very often. We have a huge adult population. We have a huge number of adults now who are going into the dementias, who are having neurodegenerative disorders, nervous disorders. They're going to need medication for that. So let's get over this thing of, oh my God, I can't possibly have a mental health disorder. It is just not a possibility. That means there is something wrong and I can't tell the world that I'm having it. That will be an issue. None of this actually happens. Let's get into a position where we accept that just like I would go to a cardiologist if I had a heart attack, or I'd go to a respiratologist if I started breathing heavily, I will go and seek the help of a psychiatrist. I will go and take the help of a person if my life is not actualized or as happy or as fulfilling as it should be. This is the Mental Health Month. It is not enough for us to talk of mental health only during this month. We have to pass on the message to everybody around us, saying that it's absolutely okay for us to have a problem, that it's absolutely okay for us to get into a situation where we will be talking to people about the way we feel without feeling ashamed about it, without feeling upset about it, without feeling that we have done something wrong. There's a huge number also of special cases associated with depression. One of them being postpartum depression, for example. When a person is pregnant or has just delivered, very often there are issues relating to the way the person feels about this. There are a number of cases now that are being referred to us, and please be aware of the fact that especially if you've been pregnant, if you've been depressed before your pregnancy, and you have been on medication, all the latest research points to the fact that continuing with the medication during your pregnancy, even during lactation, will actually benefit the mother more than stopping the medication because you're frightened that the baby will get affected. Of course, a proper evaluation has to be done. And of course, some medicines are not supposed to be given during pregnancy. But to stop all medicines just because a person is pregnant is actually setting you up for getting into a place where there will be issues related to the pregnancy, delivery, postpartum, lactation, and things like that. So once again, this is becoming an extremely important issue to deal with. We talk now also of a large number of ladies who during their menstruation period land up being extremely upset, having great emotional ups and downs, sometimes even becoming almost out of touch with reality with a large amount of aggression and things like that. They need to see a psychiatrist. It is imperative then for us to be aware of the fact that if you're not performing to the best of your ability, if you're having issues with your normal social, functional, sexual, occupational life, then you need to seek the help of a psychiatrist and see whether there is a psychiatric illness. And if there is one, see whether you need continuous help, either from a therapist or from the psychiatrist, and whether you need specialized modalities of treatment as well. That is the only way that we're going to get into a situation where we will deal with our own mental health and get to a position where India becomes a superpower, even in the field of mental health. Thank you.